So nutrition is a universal need, and people of all ages and circumstances deserve access to nutritious foods. But the two groups that have the most acute need for improved nutrition are pregnant women and children, particularly babies. This is due in part to feeding practices that have women and children, particularly girls, eating last and eating least. But it also reflects the particular health needs of women, especially mothers, and especially young children. Nutrition plays the most critical role in a person's life during a narrow window of time, the 1,000 days that begin at the start of a pregnancy and continue through the second year of life. The quality of nutrition during those 1,000 days can help determine whether a mother and child survive pregnancy and whether a child will contract a common childhood disease, experience enough brain development to go to school and hold a job as an adult. The science of nutrition points to a strategy. If we target that brief, critical period during which nutrition has the biggest impact and focus on improving nutrition for expectant mothers, new mothers, and young children, we can accomplish several things at once. We can save lives, we can help children start life on a better path, and we can bolster economic development and learning down the road. So that's the thinking behind the Obama administration's new approach to nutrition. For the first time, the United States is focusing our investments on that 1,000-day window. We're identifying millions of young children who need nutritional support, and we're sticking with them for a 3-year period to give them a foundation to lead healthy lives. We're also significantly scaling up our investments in research and development to discover what we hope will be path-breaking tools and technologies, ranging from new techniques for measuring undernutrition to new supplements to new biofortified crops. We're focusing on women, the mothers, the farmers, the health workers, the community leaders, whose insights and efforts can make the difference between a successful program and one that falls short. And we're putting an end to the stovepiping that has long hindered our government's nutrition efforts. For years, experts have been saying that this is a problem that must be addressed through a comprehensive response that unites experts and programs from across different fields. But for too long, the agricultural experts didn't talk to the neonatal experts who didn't talk to the early childhood experts. Well, we're trying to end that. And we're trying to make nutrition the intersection of two major new policy initiatives. The Global Health Initiative, a 6-year, $63 billion effort to strengthen the health systems of our partner countries, and Feed the Future, our hunger and food security initiative of at least 3 years and $3.5 billion to improve agricultural systems from farms to markets. We aim to reduce child undernutrition by 30% in our partner countries. And we know there's not one-size-fits-all approach. Different communities face different challenges. In some places, the problem is a lack of affordable, diverse, protein-rich foods. In others, the key constraint may be chronic gastrointestinal disease caused by unsafe drinking water. In still others, people are switching from traditional diets to unfortified processed foods, sounds familiar, with unhealthy results. To succeed, we have to tailor our strategies to suit our partners' specific needs and strengths. So we're supporting nutrition education for farmers and parents so everyone knows the nutritional value of a diverse diet and mothers understand the benefits of good feeding practices during their child's first 2 years. Many mothers who can breastfeed still switch too early to foods mixed with unclean water, which causes diarrheal disease, the second leading killer of children worldwide. And after infancy, many mothers do not know when they should introduce foods that they should be rich in the nutrients children need at critical times in their development. Of course, encouraging mothers to feed their children well won't work if nutrient-rich foods aren't available or if they aren't affordable. Through the Feed the Future initiative, we're helping to strengthen agricultural systems to accomplish three things: increase the amount and diversity of food grown, improve markets so people have access to that food, and increase people's income so they can afford to buy more and better quality food and put more of their daughters and sons in school. All three outcomes, we believe, will help reduce undernutrition, particularly if we ensure that the benefits reach women, who are more likely to pass them on to their children. That's a lesson we've learned in microfinance and in most programs. Focus on women if you want lasting, measurable results. So as our partner countries devise national strategies to fight undernutrition, we will help carry them out. For example, Rwanda, a country in which one in two children is stunted. The country has created a comprehensive plan that they are executing with our support. Last year, the health ministry trained every community health worker in the country to screen children for undernutrition. More than 1 million children were evaluated. And more Rwandan farmers are now planting diverse, nutrient-rich crops, not just the staple starches, but fruits and vegetables too. We're making existing remedies more widely available. Some of the worst effects of undernutrition can be alleviated through simple interventions, like giving pregnant women iron to prevent anemia, or giving children oral rehydration salts to manage diarrhea. For want of these basic treatments, millions of people die every year. These deaths are intolerable because they are preventable. And through the Global Health Initiative, we're strengthening health systems with an emphasis on nutrition, so health workers will know to provide nutritional support even if the patients don't know to ask for it. And children receiving vaccinations will also receive critical supplements. And health workers will be able to identify early those children most vulnerable to undernutrition and treat them in their homes while their families receive the education they need to keep their children nourished. We're also working to improve access to safe drinking water. We know that protects children from diarrheal diseases that deplete them of nourishment. In Port-au-Prince today, the percentage of people with access to clean drinking water is actually higher than it was before the earthquake. Now we have to maintain and increase those numbers so that the efforts of parents, doctors, families, so many aid workers, so many organizations like CARE, so many governments like our own, won't be undone with the return of unsafe water. So prevention is the watchword of our efforts. We not only want to save the lives of undernourished children, but to prevent children from becoming undernourished in the first place. Prevention is a long-term investment, and in many ways, it is more difficult than short-term rescue. But its payoffs are far greater. Our partnerships in this field are strong and growing. In September, the United States will host a nutrition and food security event at the Millennium Development Goals Summit in New York with Ireland, a country with firsthand experience of the devastation caused by food shortages and a leader in the global fight against hunger and undernutrition. We're also working with DFID, the United Kingdom's Department for International Development, which just published its first ever strategy for undernutrition titled The Neglected Crisis. Together in places including Bangladesh and Ethiopia, we will help to undo the effects of that neglect. And we will continue to work with groups like CARE. CARE has spent decades promoting effective, innovative strategies for nutrition, women's health, children's health, agricultural development, and other related issues. Many of the best ideas for how to solve this problem have been conceived by or refined through the work of CARE and its partners. And we're building on that foundation because we think it will serve us well in the future. Now we have a choice to make. 10 years ago, the world made a historic promise to solve global challenges together. Our commitment is enshrined in the Millennium Development Goals, and nutrition is front and center. as part of Goal 1, and it's critical to Goals 4 and 5 as well. But our progress on nutrition has been too slow. In fact, while we have been working on the problem of undernutrition, the problem of obesity and chronic diseases has been growing by leaps and bounds.